Helicobacter bacteria usually inhabits the mucous membrane that covers and shields the tissues that border the stomach and small intestine, which is the common source of stomach ulcers. The H. pylori bacteria can inflame the inner layer of the stomach, leading to an ulcer. You can get this bacteria by eating contaminated food or water. Did you know daily use of certain painkillers such as aspirin, as well as some over-the-counter drugs called nonsteroidal anti-inflammatory drugs, NSAIDs, might irritate the stomach's inner lining and small intestine, leading to ulcers? However, stomach ulcers are often treatable. If left untreated, they can worsen. Body signs that you have peptic ulcers. 1. Burning pain in the stomach. A scorching or gnawing ache might be present in the middle of your stomach. When the inner surface of the stomach or small intestine is being eaten away by digestive tract acid, you can develop an excruciating open wound that may bleed as a result of the acid. You may feel mild discomfort in your lower abdomen as a result of this. 2. Loss of appetite. As a result of the inflammation, stomach ulcers can potentially cause a blockage in the digestive tract. This may block the passage of food through your stomach, resulting in weight loss and a reduction in appetite. 3. Heartburns and indigestion. Heartburn is another sign of peptic ulcers. This condition is triggered when digestive juices rise into the esophagus. It causes a burning sensation in your upper tummy or under your breastbone. 4. Vomiting. Especially in the morning after starving for a while, stomach ulcers might make you feel sick to your stomach. Peptic ulcers can prevent food from passing through the digestive system, making you feel satisfied more quickly. An inflammatory reaction brought on by ulcers in the stomach might result in stomach spasms. You might throw up if they get too intense. 5. Dark stool. An ulcer is an open wound on the wall of your small intestine or stomach. These lesions occasionally bleed. Your stool may get black as a result. An oozing ulcer may be present if you observe that your stool has an appearance of digested blood, which is darker in color. Ulcers that are bleeding portray a dangerous medical problem that needs to be treated right away. 6. Bloating. When the gastrointestinal (GI) tract is bloated with air or gas, it causes abdominal discomfort. When food hasn't been fully digested or even when air is swallowed, gas accumulates in the digestive tract. Most people who experience bloating feel fullness in their stomachs. Furthermore, a peptic ulcer may cause your belly to be painful, tight, and bloated, which can be a serious symptom. 7. Acid reflux. Acid reflux is a chronic disease often referred to as gastroesophageal reflux disease, GERD. As stomach contents bounce up into the esophagus cavity, acid reflux occurs. This tendency, also known as acid regurgitation, may indicate the presence of peptic ulcers. 8. Feeling hungry after eating. After a meal, an empty stomach may indicate the presence of a stomach ulcer. Some people who have ulcers appear to be always hungry. Even after eating, they could have stomachs rumbling. Yet, the feeling experienced is not hunger but rather a discomfort brought on by a sore that is present in the duodenum or stomach lining. Well, did you know if peptic ulcers are left untreated for a long can lead to problems such as gastric cancer, internal bleeding, and perforation in your stomach lining? If you follow the methods advised like herbal supplements for treating peptic ulcers, you may lower your chance of developing stomach ulcers. It might be beneficial. Wash your hands often with a disinfectant and water to prevent the spread of infections, and only consume fully cooked foods. Be careful when taking painkillers. Act accordingly to lessen your stomach issues. If regularly you use painkillers, they can increase your peptic ulcer likelihood. Take the prescribed medication that will help you get pain relief by consulting with your specialist. Avoid consuming liquor while taking your prescription since the two together can make you develop stomach distress. Although, the majority of ulcers can be cured with a medical prescription, in some situations, surgery can be necessary. It's essential to cure an ulcer straight away. Discuss with your doctor the most appropriate treatment strategy. If your ulcer is too severe to an extent of bleeding, you'll probably need to stay in the hospital for extensive endoscopy and IV ulcer medicine therapy. Moreover, you might require a transfusion. See you in our next video for more educational tips. Remember to like, share and subscribe to our daily posts and videos. Thank you for watching.